majority of the failures did occur at measurement below 50. Then, when it comes to early loading, in other words, how can we tell whether an implant is ready to be loaded at 2 months, 3 months, 4 months, and beyond? You can see that we're starting to see some statistical measurement or value of that 50 to 59 ISQ value. And so when we achieve a ISQ measurement of 50 or above, and we perform early loading at UCLA, meaning 2 months or less, we are seeing very few, if any, failures. And that's a total of 49 implants that we looked at. With traditional loading over 2 months, and again, looking at over 1,000 implants, as you can see, success rate's still very, very high at 98%. But there again, you can see the cutoff value of 50 being significant compared to any value below 50, where the failure rates are found. With traditional loading at 2 to 3 months, it seems like very few failures, especially when the implants are buried and allowed to integrate without interference from the prosthesis. And finally, traditional loading 3 to 4 months. Again, some very high values. And so for us, what we like to do is look at the initial ISQ measurements and from there make a determination as to the loading period and the healing period. And this is our data that we're just accumulating now to report at the 2010 Academy of Osseointegration meeting in March. The efficacy of using ISQ value of 50 or above is cutoff number or cutoff point. And you can see, again, statistically, with RFA values of less than 50, the failure rates go up versus RFA values that are greater than 50, and then with 1-stage, 2-stage, and immediate loading. And so I point out the fact that we can't always look at statistics, because if you're quick enough to catch, there's very few implants that we have that measure below 50. And so this data may not be statistically significant from the standpoint of not having adequate numbers. But that's why we would like to call on all of you in the audience to start using these RFA values and to participate in submitting data for us to evaluate. So again, a cutoff point of 50 with traditional loading at 2 to 3 months, 3 to 4 months, and 4 months or longer. So pretty much the same tail. What we have found is that with the protocols that we've established, when we don't follow the protocol, as you can see here, the RFA value being very low on that posterior implant, and it still received immediate loading, you're going to get this. You're going to start pulling out implants. And so it's important to develop this protocol for yourself, actually, to understand when it is appropriate to immediate load and when it is not appropriate to immediate load. And when we go back, we look at the Hounsfield's measurements, and you can see that indeed this one implant had a Hounsfield's unit much lower in that particular region of the mandible. So we know that Hounsfield's unit are not a predictive value, but it is certainly something to compare it with. So again, reporting at the 23rd annual meeting, the success rate of 1-stage implants with ISQ greater or equal to 50 at the time of placement, it was 97.8%. Less than 50, the success rate drops to 82.4%. And success rate with 2-stage implants that had measurements less than 50, all the implants survived. So what we have done is make this statement. If ISQ value is less than 50, we do recommend 2-staging by placing a cover screw and burying the implants. If it's greater than 50 but under 60, we can consider 1-staging by placing a healing abutment to avoid a second surgery. And if ISQ values are greater than 60, we may consider immediate loading or provisionalization. When it comes to immediate load, however, that was for early loading. If it is a completely edentulous, it really does rely on ISQ measurements, and depending on whether you're connecting it or using it as an individual unit. With partially dentated, again, what we do is look at ISQ values, compare it to Hounsfield's measurements on the CT scans, and if it's less than 45, less than 500, we two-stage. Greater than 500, but between 45 to 55, we can consider one staging. And if it's greater than 500 Hounsfield's unit, ISQ values greater than 55, we are considering immediate provisionalization. And for single tooth, we don't typically get CT scans, so we rely on insertion torque value as well as ISQ values for two staging, one staging, and immediate loading. So with those protocols that we're seeing, we are getting close to 100%, and that should be the target for all surgeons, to provide our patients with 100% success. So with that, I thank Osstell for giving us the ability to measure and to determine the rate of integration that we can achieve. Thank you.
Thank you very much. Thank you. And by that, I thank you all three speakers for excellent lectures, and also thank all of you for coming here this early time on this Friday morning in Monaco. Thank you very much. Bye-bye.